that, I want to welcome our other friend, Dr. Peter McCullough. Thank you for joining us today.
Well, it's great to be on with you in such times of great controversy, no doubt about it.
No doubt about it at all. But I'm hoping that we're going to have some positive news today, because I saw what you and your colleagues were working on. There was a study that you guys had just recently done, an observational study that has to do with ivermectin and mebendazole. Please tell me about that study that you guys conducted.
McCullough Foundation teamed up with a wellness company, which is now the largest vertically integrated alternative health company in the world. And we sought out to investigate why patients with cancer were taking the combination of ivermectin and mebendazole. It's their choice to do so. It's clinically appropriate, medically necessary, off-label use of the medicine. Recall that ivermectin and mebendazole are both anti-infectives, but they have anti-cancer properties. In preclinical studies with ivermectin and actually in clinical studies with mebendazole, both drugs by separate mechanisms do three things. They reduce tumor proliferation, reduce angiogenesis or blood vessel formation around the tumor, and then they cause the tumor cells to shut off, apoptosis. And so we had about 200 patients go through the study. I believe just over 120 were at the 6-month mark. They reported in on their CT scans and PET scans and how they were doing. Now, the most common cancers were prostate in a man, breast in a woman, and then lung cancer in both groups. They were mainly solid organ cancers. A third were already in remission to start with, and then the rest of them had active cancer. And so what we found is that those largely in remission stayed in remission. About a third with active cancer didn't progress, which is great news. And then 16% of patients, there was a regression. The metastasis improved. So this is great news. This is by what's called patient-reported outcomes. The overall, net positive of this was about 84% of patients. It was a wise thing to do. About 25% had acceptable side effects, GI side effects. So it's a real-world study. But it is patient-reported outcomes. All of this needs to be verified, and it's a clear signal to Robert F. Kennedy and the National Cancer Institute and Dr. Jay Bhattacharya in the NIH to do a large prospective randomized placebo-controlled trial.
Okay, so that would probably be the next step then, is the placebo randomized trial. So was the point of this trying to get some information to say, hey, this is a possibility so we can look into this further? Is that what the point of the study was?
Absolutely. Now, listen, if patients reported that nothing happened, the cancers didn't get better, things progressed, it looked like it wasn't doing anything, that would have been a useful report too. We would have said, listen, we don't see anything positive here. So, the best thing about research, especially early research, is to look for a signal of benefit. And that's what we found here, acceptable safety. So I hope the National Cancer Institute does not slow walk this.
This is my fear, okay? Because I think they've been knowing about some positive cancer treatments for years. This is just my hypothesis. I think the medical industrial complex makes money off of sick people, so they don't want us to get better. Because I know about Laetrile. I don't know if you know about Laetrile, but I've been hearing about Laetrile and how there's some doctors that are using it as a adjunctive therapy to cancer. And now I've been hearing about the mebendazole, fembendazole, and ivermectin. My fear is the medical industrial complex isn't going to want this information to come out. So they're going to, like you said, slow walk it or keep pushing it back. So do you have any fears about that? Or, do you think that we're at a point now where it's going to be accepted in the medical community, where we're going to look at alternative treatments to cancer besides just chemotherapy? What do you think? What are your perspectives?
I understand your suspicions and actually pessimism. The Institute of Medicine says from the time it is known that something is beneficial to the time it's actually routinely implemented in clinical practice is about 20 years. So the wheels turn very slowly. So the first step was to have our peer-reviewed manuscript fully accepted to a cancer journal, which we did in record time. So it will be appearing in the peer-reviewed literature in a major cancer journal. So that's step one. And step two is there needs to be a whole, array of studies done. There's a small ivermectin study at Cedars, UCLA in advanced breast cancer. Johns Hopkins, which holds the patent on mebendazole, is studying this in CNS tumors. But we're stuck in this paradigm in cancer centers called book and bill. So a cancer center can actually purchase the chemotherapy and then resell it to the patient, and their insurance companies pays for it. And the cancer center makes a percent income from administering the chemotherapy. So it makes sense that they would administer expensive chemotherapy so the cancer center earns a greater revenue from that administration. The cancer centers are not incented at all to use low-cost generic medicines. And so people may ask, in cancer, how come generic medications aren't used at all? And that may be the reason why. I'm a cardiologist, and I can tell you over 90% of the drugs I prescribe are generic medicines. They're essentially, $3 to $10 a month. So they're very inexpensive. But the same is not true in cancer. So here we are. We have a dilemma. I don't think anybody intentionally wants anyone to get sick. People go into medicine with altruistic motives. We want people to get better. We don't want people to get cancer. But we'd like to see the incentives for the cancer centers to look at these what's called repurposed drugs. Why not look at some drugs that have anti-cancer properties that are available in generic and do large trials? I mean, we can learn so much from large randomized trials. And boy, the NIH has huge budgets. They can afford this.
With our former NIH director, I don't think that would have been possible at all. Dr. Fauci, I don't think he would have. I think was part of the medical industrial complex. I think for him, it was more about it's just my personal opinion, about the dollar versus people's actual health. I'm hoping with this new leadership that we have at the top with our health that they will think more about people's health versus the bottom dollar. At least I feel that way about this administration. Now, I hope that is true. And I agree with you. I'm not saying that the doctors are going into this with an ulterior motive, but we know there's greater than the doctors. We've seen even private practice. We've seen these conglomerates eat up all the primary care physicians. They can't even practice on their own hardly without really competing with the big corporations. So medicine is just really changed since, my father came here to this country from a medical missionary. He sponsored him and he was like a small town doctor. He did everything. So medicine has really changed since those times back in the 70s and 80s.
It has, but, let me respond to that. The former director of the National Institutes was Francis Collins. And Francis Collins is notable for leading the Human Genome Project. And he's published books about, he believes this work with genetics he's learning the language of God. So if you read Francis Collins' books, it almost seems like he believes he's close to God through this scientific work. And remember, Anthony Fauci, he was the director of the National Immunology, Allergy, Infectious Disease Branch.
That's true. That's true.
Fauci said that, he represents science. So here we have at Collins and Fauci, we have tremendous hubris and arrogance. Now, the new director of the National Institutes of Health is Dr. Jay Bhattacharya. He was in my group at Fox when we were frequent commentators, and I know him personally. He's a very humble person, but he doesn't have a strong research or clinical track record. I imagine at the NIH, quite honestly, he's probably not internally respected or revered. And he's been there a year and a half, and absolutely nothing has been done. Nothing. So, and we could say the same thing for Robert F. Kennedy. They're essentially going on podcasts. I imagine it's very hard for them to even get a meeting together, let alone get anything done. So we haven't seen any new requests for applications for innovative approaches to cancer. We haven't seen any innovation on the spike protein and COVID-19 vaccine injuries, disabilities, and deaths. We've seen a few presidential executive orders, but there are things that are going to be most of the presidential executive orders are to stop doing things. So, for instance, to stop doing transgender medicine or to stop funding biolabs. Most of the presidential orders that are positive are either low level or kind of off target. So one of them was to drink whole milk, presidential. Like whole milk, I mean, the kids are already too fat as it is. It's just going to give them more fat and just raise their cholesterol. I mean, that one's is a loser. And our research suggests it was all funded by the dairy industry, who's financially incentive to not create low non-fat milk. And then we saw a recent executive order on psychedelic medicine.
Yes, we did, and I was curious about that. I mean, if it helps PTSD, fine, but I'm nervous about the idea that it's a psychedelic medicine.
Well, I mean, Joe Rogan was there and what have you. And so there's kind of three psychedelic medications. One is psilocybin, which is like and that's being developed for a treatment-resistant depression. And what you need to know there is these are not at-home drugs. So these would be very rarely administered. So it would be in the hospital, you give one dose, patient has to be observed, and then you wait like another month and give another dose. Like what happens after that? I mean,
I don't know.
So it really alters their sense of reality. The other drug is called, I believe it's called MDMA, and that is being developed for PTSD. And it was brought to the FDA in 2004 for PTSD. It didn't look like it worked very well, and it was rejected. And again, you give one dose, I think, in the hospital. And then the last one is ibogaine, which is very worrisome because you give that and it clearly affects the cardiac EKG and puts people at risk for arrhythmia. So they have to be on the cardiac monitor and what have you. So, I mean, I look at this as a doctor and I said, listen, is that worth an executive order? I mean, I don't think so. It's $50 million of funding, which isn't much in the research space. It's like, is that worth a White House meeting? My interpretation is I don't think so. I mean, I'd like to see, hundreds of millions of dollars of research go into the spike protein that we all got exposed to from the SARS-CoV-2 infection and the vaccines. Right. That's a much bigger problem than any of these things.
Especially because if you're thinking of donating blood, okay, if those of us didn't get that vaccine and if we ever needed a blood transfusion, I think the likelihood of all of us getting that spike protein is very high.
No, I disagree.
No?
What we know now is that, a unit of blood lasts on the shelf only 42 days. So it's not like they sit there for years and years and years. Yeah. And probably the freshly vaccinated patients did have a lot of RNA and spike protein in the blood. But, nowadays, the CDC won't even tell us who's taking the vaccines. There's probably so few, it's probably embarrassing.
Well, that's true, but doesn't it continue to replicate in your body?
No,
it doesn't. I think
we have found people with multiple doses it can be circulating in the bloodstream, but it doesn't multiply itself. I think the body slowly gets it out. By the way, I think sweating removes the spike protein. So I always tell people to sweat. I know you're in a hot climate, so am I. So it's good to sweat that messenger RNA out of you. But I think the blood supply is low risk. If someone needs a transfusion, they should get it. I do think the American Red Cross and all the blood banking, they should ask people if they took a COVID vaccine.
Yeah.
Just like they ask you if you've traveled to Africa and if you've had any of these bloodborne illnesses, they should, because of the COVID vaccine is so dangerous. But we haven't seen any alarm by the medical establishment at all on the big ticket thing of SARS-CoV-2 installing the spike protein in the body and the COVID vaccines, which have been a disaster. To me, everything else seems pretty minor.
I'm really glad you told me that because I've been under the assumption that your body is going to continue to replicate the mRNA, like that from the vaccine. That's what I have.
No, you have a set amount of messenger RNA you took from Pfizer and Moderna, and it's a matter of the body getting rid of it. The body, as far as we know, doesn't replicate it. Now,
praise God, that's great news, Doc.
Right. Well, we've shown in one paper with Dr. John Cantazzaro, Nick Hulsher, and myself that a piece of Pfizer can install itself into the human DNA but it's a very small piece, and it can't replicate the whole spike protein. We don't even know what it does in the human DNA, and hopefully the body snips it out. But as we look at these broad array of concerns out there, it's an archetypal fear that we've all been poisoned. It's a fear that's gone on for centuries. And in reality, we have been poisoned by the SARS-CoV-2 infection, which came out of a Chinese biosecurity lab, and it's well documented. 90% of us have had the infection, and 81% of Americans took a vaccine. Now, you and I didn't take it, but 81% of Americans did. They've been poisoned by a vaccine, an extra spike protein. Now, everything else, but you can tell that these fears are brewing. I don't know if you saw in front of the Capitol building or one of I think the Lincoln Memorial yesterday or day before, there was a big rally regarding glyphosate, right? The herbicide. And again, the spirit of this is that we're all being poisoned. And you'll hear people say, well, we're all being poisoned by fluoride. We're being poisoned by microplastics, by 5G, by ionizing radiation and ultraviolet with global warming and the ionosphere. And it goes on. And our job is to kind of sort through this and figure out what's really a risk to us and what we can do about it. For the SARS-CoV-2 infection, which I think is a poisoning, I think everybody should be on a nasal spray and gargle twice a day. Wellness Company makes Immune Defense. It's a great product. I like the Clear Company. They make Spry and Clear nasal spray, but I do it twice a day. That's kind of my poisoning defense for the infection. Don't take any COVID vaccines. I'm not taking them at this stage. Would you ever take one, Amber, yourself?
No, and I didn't during the hype of it. I didn't. There's just something inside. Like, I don't know. Like, God told me to start my show up again. I don't know. Maybe he just gave me something inside of me. It was like, don't take it. Don't take it. And that's where, I got to meet you and hear from you and other experts about not taking it.
Amber, did your kids take it?
No.
Did your husband take it?
One shot.
Yeah. Well, all of us have that.
Most of my other family had taken it.
My wife didn't take it. My daughter didn't take it, but my son did. So all of us have this, and we're greatly concerned about our family members. Make sure your husband's on the ultimate Spike Detox from the Wellness Company. Very important. At least 2 capsules twice a day, empty stomach. We've also shown that liver detoxification may actually help get rid of the vaccine itself.
Wow.
And so Ultra NAC, which has not only N-acetylcysteine, but it has milk thistle and some other liver detoxifants. So he needs both of these products from the Wellness Company, Ultimate Spike Detox and Ultra NAC. That's our mainline approach for people who have taken these shots. And then, of course, therapeutic sweating. We're at the point now we're telling people to get maybe infrared saunas or little teepee.
I have an infrared blanket or mat that I've been using.
Well, you may want to just get him to get in a sauna. Buy one of those little teepees, set it at home. They're very inexpensive. Get in there and sweat and get this stuff out of him.
Let me ask you this. Going back to the cancer study that you guys did, and you said it was mostly that the cancer you were looking at mostly was breast cancer, prostate cancer. Do you think there's hope, or do you think that there could be positivity in the other kind of cancers out there for the ivermectin and mebendazole? Or do you think it's specifically only going to help these certain type of cancers if you were to take a hypothesis?
Well, if I divide them into solid organ cancers, like, of the lung and prostate, bladder, kidney, breast, solid organs, I think it's, more promising. Okay. For the blood cancers like leukemia, lymphoma, myelodysplasia, I'm not sure. I simply don't know. Because mebendazole penetrates into the brain, it's being featured for brain cancer, which is pretty rare. But we're in a circumstance where, listen, there's some positive study. It's going to come out in a major peer-reviewed journal. We're going to follow up on all the scans and follow people at 12 or 18 months. There's 20 million cancer patients out there right now. A lot of cancer patients are saying, listen, I can't wait around for Robert F. Kennedy and Jay Bhattacharya to do something. I just can't. I've got to do something. They're going to the Wellness Company, twc.health, /focal points, or if you have a code, Amber, do you have a code for Wellness
I
Company?
used to. I don't know if it still works. Amber.
Amber, or actually do both codes, focal points and Amber. Get into the system, go through it with a doctor, sign up. So we'll follow this over time and get the ivermectin-mebendazole combination. Now, patients under my direction, I look at everything, provided kidney and liver function is good. I advise 1 capsule twice a day. Like, what do you have to lose?
Right.
This is in addition to surgery, chemotherapy, and radiation therapy.
So my understanding of mebendazole was it was a anti-parasitic medication. Is that true? It's an anti-parasitic?
Right. Both ivermectin. Well, ivermectin is antiviral, antiparasitic. Mebendazole, antiparasitic. But these drugs work inside cells and they work at multiple levels. And so it should not be surprising that they have some anti-neoplastic effects. Remember, a lot of cancer drugs come from natural sources, like Taxol from the yew tree, for instance. So this is not a foreign idea in cancer. And so, and believe me, Johns Hopkins wouldn't hold a patent on mebendazole if they didn't think it's potentially anti-cancer. I mean, it just gives you an idea. What we're saying is we need to reduce this to practice. These are generic medications. Get them out there and available to patients. Now, I tell patients, listen, review this with your cancer doctor. And right now, probably more than half of the cancer doctors are saying, listen, go for it.
Okay, that's a good thing. I wasn't sure if they were going to push back against that.
We've got a positive signal. Why not? So go to twc.health /focal points, use a promo code AMBER. And those of you out there with cancer or loved ones with cancer, look at the combination of ivermectin and mebendazole.
Yeah, that's good. Let me ask you one more question. In terms of like cancer, what do you think about some of this adjunctive therapies like red light therapies or hyperbaric oxygen chambers? Do you have any knowledge or information on how that affects people?
It's not my field, but I know Nick Kulsher at the McCullough Foundation is following this. He recently posted, high-dose vitamin C as an adjunct to combination chemotherapy, probably for its antioxidant effects, and it's probably having an effect on the normal cells and tissues. But I think he reported like 75 grams, which is a huge dose. Many cancer patients are searching for alternatives. And, there are alternative medicine cancer centers out there, holistic. And, I think as long as it's done along with the conventional approaches, why not, provided they're not harmful.
Yeah. Well, I just think so highly of you, and I'm so grateful you came on the show today. And once I saw that come through, I had to have you on because I think we all know people going through cancer, and if there's anything we could do to help them through that period of their life, to help them be healthier, to overcome cancer, I'm all for that. I want to know all the things we can know about that. And so if I ever had cancer, I want to know what my options are, and I'm sure other people want to know what their options are too. So I want to thank you for doing this study, and I hope that more studies will come out from what you guys have done, you and your colleagues.
Well, thank you. Thanks so much for having me on the program. Make sure you follow me at McCullough Foundation, McCulloughFND.org. That's what funds all of our critical research and our manuscripts. My professional website for patients, PeterMcCulloughMD.com. My office is in Dallas. That's where I am right now. I have a patient coming in shortly. And then, of course, my podcast, America Out Loud McCullough Report. By the way, I've had some great interviews on how to orient the diet to prevent cancer and these advances there, certainly a big focus on heart disease. And then, of course, the Wellness Company, twc.health /focal points, use a promo code AMBER. And for those with cancer and those who've had COVID or taken the vaccine, make sure you get the products we talked about today, the Ultimate Spike Detox, Ultra NAC, and consider Ivermectin-Mebendazole. Thank you so much for having me.
Thank you. Take care, Doc.
All right.
Thank you for joining us today on The Amber May Show. I hope you enjoyed this episode. Please make sure you like, share, and subscribe. And if there's someone that came to mind, please share this episode with them. Please follow us on Telegram at The Amber May Show, True Social Amber May, Frank Socially Amber May, or Clout Hub. I can't wait to see you next time on The Amber May Show.